A lot of people have kind of the misconception that you have to go out and lift heavy weights and work out for like an hour, though. That's not the case. Just get out 3 to 5 minutes, just a movement a day will help level out your blood pressure, your blood sugars if you have diabetes. Just that movement, and it helps circulation, things like that.
So, what's your typical day like?
Oh, great question. When I'm in the hospital, well, with that, even clinic and hospitals are of course a little different, but as a nurse practitioner, you are responsible for the assessment of that patient. So you're assessing the patient, diagnosing the patient, managing the patient. So when I go and see a patient, and when I go see the patient, then I come back and tell my cardiologist or tell a hospital medicine specialty that I'm collaborating with. I'm like, they came in with all these kind of signs and symptoms and all these complaints, and this was my physical exam. So I found this. This pain is out of proportion to this. It's something where my kind of your spidey senses go off and your experience goes off, and you're going, something is here. We need to investigate this. I sent this test. I'm looking for this. So when I send any tests, diagnostics or labs or imaging, anything, I am prepared to tell the rationale of why I sent that, what was making me think, critically think through critical judgment, a clinical judgment that said, why are they sending off this and what information is it going to give us? So the information it gives us, then that will make our plan. So then I make a plan as to, and it can be almost instantly. Somebody coming in with very high suspicion of they're having an acute MI, a myocardial infarction or a heart attack right now, that is fast track. That is, I'm looking at them, I'm listening to everything. I'm calling my cardiologist and the cath lab and saying they need to go now. They need to go very within the next 20 minutes type thing. So, and it can be like, okay, well, this one, let me sit on this a little bit because it sounds more like blood pressure causing the chest pain or something else. They're have pneumonia causing the chest pain. Chest pain can be so many different things. But so we do assess them, diagnose something, send off the labs, images, things like that, and then formulate the plan. So we formulate the plan, then we collaborate with all the specialties and get, and of course have the patient involved and the family involved if we can, things like that, to get that plan that works for the patient centered and patient. They are helping us in the decision making process of what we want to do. And we do come across every now and then that they do not want certain, we're like, you probably are going to need open heart surgery. And they're like, nope, just medical man. But we give them, here's plan one is medical management. We're going to optimize your medical management, optimize your blood pressure, optimize everything we can. Your cholesterol, you're going to stop smoking, you're going to control your diabetes, blah, blah, blah. So it's all optimization of medical management. We can go to surgery, but you're still going to have to optimize all those things. And some people just don't want surgery. And that's so we make sure that they know the risk benefits. And but as a nurse practitioner, that is what we do all day too, is talking to them about the risk benefits, educating them on anything that, and telling them how that would improve their quality of life, their functional mobility, or anything that they have, answering questions, and a ton of questions sometimes. Sometimes I know we go in with a bunch of information all at one time and they don't know what questions to ask. So yeah, it's a lot sometimes. So we have to weed through all that and make sure everybody's on the same page. So.
I have two questions.
Yep.
So, the first question that I have is, what are some things people should know about heart health but isn't really mainstream information? And then my second question is you said that you recently moved from Florida to Nashville, and you also said that being a nurse is easy for you to move around, but
Mm-hmm.
how is that for a nurse practitioner in moving to different states? Do you have to like retake any exams or retake any license to like make sure that you're updated in that?
Yeah, I did have to moving from Florida. I'm still licensed in Florida. I'm in Florida right now. Actually, I'm seeing patients at the free clinic on Monday, and still, so I'm still licensed in Florida. Can work at the different hospitals here, the clinic here, and things. So, and I will always keep my Florida license. But when I did move to Nashville, I did have to get a Nashville a nurse practitioner license and a nursing license. Some states have a kind of reciprocity that if you're licensed here, you can still work here, things like that. So just look into whatever state that you're going to, make sure that you're licensed correctly. And sometimes it took, I would say about 2 or 3 months from the time I started. But my son, in early this year, in February 2025, he had a kind of clinical change in his congenital heart status. And so that made me want to go to a big center, a big like Vanderbilt. Vanderbilt is a huge teaching center where they are not just, I don't want to say just reading the studies, but they're actually doing the studies. So I wanted to be at a place where I could see his type of congenital heart disease every single day instead of once in a while. But it was, so for me, it was so right when I started looking at big centers to work at, it was Emory or Vanderbilt, big teaching centers. And Vanderbilt posted something for a inpatient cardia. It was just divine intervention, I'm telling you, because his thing happened in February. By the end of February, Vanderbilt was posting that they needed an inpatient cardiology nurse practitioner. I was like, yes. So I immediately applied for it. But as far as and going back for 1 second, but they did require I do another certification through the Mayo Clinic. So every hospital is different the things that they require. But I've always, for the past 25 years now, have been, maintained all my licenses and certification and my critical care type, acute care, advanced cardiac life support, things like that. So but the one thing about that I need to tell people in the community constantly, because they know don't smoke, keep moving, get walking a little bit. A lot of people have kind of the misconception that you have to go out and lift heavy weights and work out for like an hour, though. That's not the case. Just get out 3 to 5 minutes, just a movement a day will help level out your blood pressure, your blood sugars if you have diabetes, just that movement, and it helps circulation, things like that. So it can only be the 3 to 5 minutes. I did a paper one time using a Canadian study that was 3 to 5 minutes a day, well, for 3 to 5 times a week. Literally helps so much with the smoking sensation, that stopping the smoking, controlling blood pressures, controlling diabetes numbers and blood pressure numbers, things like that, and circulation. But what was really great about that study is they found 3 to 5 minutes 3 to 5 times a week, then became 5 to 10 minutes over the next 3 to 6 months. And then people just started getting more active and started getting healthier. And so starting slow, starting very manageable. But the one thing I need to tell is that people may not realize is how much stress hormones have such a huge impact on your cardiac health. So much now that we are when you come in, I I send off stress hormone levels. So it is a one when I say stress hormone level, I send off inflammatory markers. So that stress hormone can cause inflammation in your vasculature, in your arteries and veins, in your heart muscles, things like that. That you don't, your blood or your heart wants to be able to pump blood nice and easy. Doesn't want to work too hard, just wants to pump. If it's pumping again, your heart's a muscle. If I told everybody, all of you and everybody listening, stand up right now and do 1,000 squats, y'all would all think I'm crazy. Yeah. So, but your leg muscles will start screaming at you and saying, I can't do this. That's what your heart is doing too. When your heart's a muscle, and when it has to beat and pump against really high pressure in those veins and arteries leaving your heart to go to the lungs and go to the body, when it's having to work against really high pressure, it starts saying, I can't do this anymore. I'm like, something's going on. Then you start having the chest pains or heart failure type things. So definitely control the stress. Everybody knows, stop smoking, get moving, get plenty of rest, watch your diet, things like that, which are all great. You need to do it and get your sleep and know your numbers, manage those blood pressure numbers and your blood sugar numbers. But it's the stress. It is the stress hormone that is coming up big time now in our national conferences going, we need to control people's stress. So, and I'm talking from somebody that is under a lot of stress all the time. So I need to control my stress too. So,
Well, that begs the question. It used to be that people, if they had symptoms, they would go on WebMD and see what I let me just put in my symptoms. Now with AI, what do you think about the role of AI in assessment or diagnosis and those things?
I love that question because we do get it all the time because people come in all the time with Dr. Google right on their phone and they're saying, well, they told me I have this. It's a very, as a clinician, as a somebody, a provider that can use it, it is a very powerful tool in our toolbox. And that's just one tool. It is never going to take, and it's that whole Spider-Man kind of thing that's like with a lot of power comes a lot of responsibility. Takes a lot of responsibility to pull back on that and use your clinical judgment and clinical reasoning and clinical, the most important thing, clinical touch and skill. Nothing is going to replace that physical exam because we still use a lot of the images that we use in AI and their reasoning they send us back. It will still probably say at the bottom of some of these things correlate with clinically, correlate with your clinical judgment. So we use them. It's a powerful tool. I love it. Even if we are dictating, and I can put Chat GPT, that my phone can listen to everything I'm saying in a encounter with the patient in my assessment, and then it'll formulate a whole note. But I still have got to go back as a provider and make sure it's all correct. A very powerful tool, but ton of responsibility comes with it. And you cannot just take that. Nothing's going to take the place of caring, for one, and hands on touching and hands on assessment. That just needs to be the skill at the fundamental foundation of nursing, of medical doctors, is that hands on caring and the assessment skills. So, yeah, but I love it. It's cool.
But before I ask my next question, and Kiana can fact check me post edit, but I was watching a show this week and it was like a trivia question
Okay.
that your heart pumps all of the, like it circulates all the blood in your body every 30 seconds, which
I would say it's true.
yeah, that's like your most powerful muscle, I would say. A lot of
It
people are
is.
like, oh, it's your tongue. I think it's your heart.
What did they say on the show? Was it true?
I guess it was Alice in Borderland, which is like a Squid Game type. So if you were wrong, then it shot arrows at you and you died. So I don't
Oh,
know
funny.
if it was right or wrong, but like I haven't Googled yet. I haven't asked Dr. Google if that was
It
true, but
sounds, yeah,
mhm.
about the timing's right, but it is.
Okay.
And a lot of things can affect that, what we call that cardiac output. So a
Mhm.
lot of things can affect that output. High blood pressure is definitely one of them.
Mhm.
Like I said, if your heart cannot pump just a nice and easy flow and that pressure in all your, what we call systemic vascular areas are so tight with blood pressure issues, it makes your heart work harder. So it cannot have that output as easily.
Mhm.
But that's the goal, is to have it easy. And then of course if you are an AFib, if you have irregular heart rhythm, it's not pumping efficiently, then we need to get it back into rhythm to pump efficiently, or at least slow it down so it can work nice and comfortable, relaxed. So yeah, there's a ton of different cardiac thing. There's structural, it's your valves, coronary, which is the arteries around your heart. It's electrical. It's like your heart is a house. It has the electrical, it has the structural, which is all the windows, and it has the muscle itself. So there's all different aspects of a heart that need to be looked at. So very complex. I love it. I could talk hard all day, but
I
and
love
that's what I
that
usually
analogy.
do. Advocacy. That's what I usually do, is the talk hard all day with anybody that'll listen up on the hill. So.
Yes. So through all that advocacy, the free clinic, working at your hospital, how do you remember your why?
That's easy. That's I literally, and I have a podcast, and that's actually what I
Mhm.
talk to my guest about, is their why, because I know my why. I have a post-it note that I carry in my lab coat with me that says, "Never forget why you started." always remember why you started type thing, and why you do what you do, and surround yourself with people, like-minded people. So when I'm in the hospital and everybody's in cardiology, and all the purpose of everyone is my why type thing, it's just very empowering. So I like to empower my patients. Mainly, my why is my son, being born with congenital defect, a heart defect. He's had 5 heart surgeries. He's graduated college. He's an author, wrote a couple of books. So he is very, to my why is to try to make every other patient. And I've told him many times that he has saved so many patients in the community through him. Just me switching over to from business to cardiology itself and doing outreach to the community, teaching patients. And I don't know, it's hard for us to say who I helped, because if they manage their blood pressures and blood sugars and stuff, every now and then I'll have a patient come up to me and go, "Oh my God, my blood pressure is this, my cholesterol is this," and especially at the free clinic. I've had them come up to me and give me a hug and say, "Oh my gosh, I've lost so much weight and my cholesterol is better and my heart rate's better," things like that, and they feel better. And but we don't know the ones that didn't have acute kind of heart attacks or things that, so it's hard to gauge who you saved. And I hate the air quotes for anybody just listening, but it is. But that's my why. Is to My why is he gave me my why. He gave me my passion and purpose in cardiology, and then it's just continued on why I do what I do. Is I see it every single day when I'm in the hospital, from my intervention, what I am doing or teaching or giving or assessing, that patient was somehow, their quality of life was improved, their education on their disease process was improved, their plan of their living, their functional mobility was improved. Yeah, so I can see it. Yeah, it's sometimes hard to put down on paper, but yes, you went from this to this, and it was because of what we did, the whole team type thing. So yeah, I love what I do. No.
When I was looking at your CV, I saw that you're
Yep.
very involved in legislation for heart
Yep.
related issues. Like you were involved with the Congenital Heart Features Reauthorization Act, and you're also
Yes.
serving on the American College of Cardiology Legislative Affairs Committee. What heart issues do you think require a platform, and how is it for you to advocate for these like issues when it's like difficult maybe to diagnose because you can't see the heart?
Yeah. It is. I love what I do, so it's easy for me to walk up and meet. I just met last week. I was in DC and I'm in Tennessee now. So I met with Senator Marsha Blackburn and Senator Haggerty, and it is very nonpartisan. I will sit and talk an ear off of any legislator that will listen. So it is Democrat, Republican, whoever wants to hear about their constituents in their community need to have heart health. So when I go, I was just in DC, like I said, I was there advocating with American College of Cardiology. There was maybe 6 of us in our Tennessee group. And we went and met with, like I said, Democrat and Republican leaders and told them it was a little bit different last week. I don't know when this will air, but we are still in a government shutdown. So they were there, and their at least some of their health aides were there, and their health policy legislative aides were still in on the Hill. And I was advocating for telehealth, access to telehealth, and making sure it was permanent, made permanent. So it started in COVID. We saw that it worked. It works beautifully. So we need to keep that and make it that it is in these rural communities that may not have broadband or access to healthcare. They need that broadband. They need that telehealth for outreach. And then I was also talking about CMS, the Medicare, Medicaid reimbursement. A lot of rural clinics cannot sustain their patient load in their clinics, and have it's a higher cost of doing care, a higher cost of having an open clinic. And if they're not getting the reimbursement from Medicare, Medicaid as a provider, it's just they have to shut their clinic, which shuts down access to a whole community. So that one barrier of access. So we were asking for increase reimbursement at least up to the CBO, the Congressional Budget Office. We were asking, please just increase it to where we can keep doing our care that we need. And the other thing we were asking was about maternal health. So anything maternal health, having to make sure that any pregnant woman was getting the not just primary care they needed, but cardiology care that they needed. We do have patients come in that are pregnant that we need to make sure their valves are okay and that they're having either arrhythmia issues or some kind of heart blood pressure issues, things like that. So maternal care, those are the three big ones that we were definitely knocking on their door and saying, can you please? But Marsha Blackburn, actually went to see her and she was there, but she had actually sponsored one of the bills. So we were asking them, if they didn't sponsor it, please support it. And but then the SHIFRA, the Congenital Heart Futures Reauthorization Act that you brought up, he was actually a Gus Bilirakis, a representative in Florida when I was there. So we went to meet with him. And so the first one was signed under Trump's first administration, and then they just signed it again. So when we go and ask for those appropriations things, we need those for increased funding or to at least maintain the funding, maintain the research for the data, the registry, things like that that help us help their constituents type thing. We need to keep our eye on all of these patients and these trials and these different studies that are going on. And that was the other thing. At Vanderbilt, there are so many studies going on, and they cut a lot of funding. And we were saying, leave the studies alone that are cardiology or cancer or things like that. The big ones, don't touch those. So that's how I know they hate seeing me coming, but yeah.
Yeah, maternal health is also the global campaign for the WHO this year, and I wrote about that in a blog on one of our sites.
Cool.
And
You know way more about it than me then, so.
No, I don't. But like how the US leaving WHO really impacted the reach that they get now, because I think they were almost like a third of the funding and research that went into the World Health Organization. So I'm glad that you're still doing a national wide maternal health and things like that for legislative, because it's very important. And I didn't think that preeclampsia could also lead to heart. It's very interesting.
Not managing them properly while they're pregnant, prenatal care is, then they come to see us post and they're already, their valves are in positions that now they need more care that could have been prevented. So it's all preventative medication or preventative care. But so yeah, we definitely were asking for, we need the prenatal care, the maternal health care side to make sure the baby's born properly and the baby's growth is proper because the mom's heart is functioning okay, and things like that. So now we're dealing with two wives. It is so huge importance. So I'm glad you were, but like I said, you probably know a lot more about that than I do right now. So I will leave that to you. I will defer.
Well, one little final question. If you could wave a magic wand, what societal changes would you like to have happen to improve the care of cardiac patients in the US or globally?
There's a lot, but the easiest things, if I could give every household a blood pressure cuff and a pulse ox, just a pulse oximetry thing that you put on your finger and make sure your heart's okay, your oxygen's okay. That would be one thing. Just give it to everybody. It's so hard sometimes to get those for patients, and it shouldn't be. It shouldn't be difficult at all. So those things, and then the education, American Heart Association, American College of Cardiology, I do a bunch of stuff with both of them. Is education. If I could wave a wand and there would never been a cigarette invented, that would have been wonderful. The cigarette, but if I could also just wave a magic wand and let everybody know how pervasive blood pressure disease is, to manage it, at least go and know your number. That would be, if I could sprinkle dust everywhere and go, do you know your blood pressure? Go get your blood pressure taken. But that is probably the hugest, is that a word, hugest? The biggest culprit we see in the ER, in the hospital with these heart patients is their blood pressure just out of control, coming in with heart attacks and strokes. So that we really need those. And the other things is the diet controlled. I love my diet. I love junk food like everybody else or things like that. But so those will come. But yeah, it's if I could give everybody a blood pressure cuff, that would be probably that would probably be the first thing I do. I know it seems so simple, and I don't know if you wanted some big grand answer, but
No,
just
no,
so many
simple
people.
is best.
Yeah, it's like they come in with the first time they ever knew they had high blood pressure was when they come in with a stroke or a heart attack. It's like, and we want to prevent that.
All right. Well, thank you for studying with us today. We hope you can join us on our next podcast episode where we'll have another study session discussing social science in reality.